Hello, I'm back. This video is about interviews. I have gone on countless interviews. Most of them were for medical school, residency. What are some of the questions that I've actually gotten on interviews? I'm just gonna list them out, write them down, watch this video over and over again, get these questions down because these are real questions that I was asked. Tell us about yourself. Why do you want to be a doctor? Why do you want to go to our program? What makes you a better candidate for our school than all the other applicants? What are 3 of your strengths and 3 of your weaknesses? Tell me about a time that you had to make an unpopular decision. Tell me about a time that you had to be a leader. Tell me about a time when you were in a disagreement and what the outcome was. Tell me about a challenge that you had to overcome. Tell me about a research experience that you had. What were you studying and why did you study it? What inspired you to study that research? If you had to describe yourself in 3 words, what words would those be? Do you see yourself practicing in a more rural area or in a big city, and why? You seem to have a lot of different interests. What are you planning to do with all of your skills? What do you foresee yourself doing in the future with all of your skills? If you could change one thing about the medical system, what would you change? In 30 years, you are somehow very rich and very famous. What would you be happy with as the reason for you to be rich and famous? Who is your role model? If you went to dinner with 3 people, and it could be any 3 people dead or alive, who would those 3 people be and why? What do you like to do for fun? Where do you see yourself in 5 years? Where do you see yourself in 10 years? Where do you see yourself in 20 years? So I also got a few clinical scenarios that I had to answer. None of these clinical scenarios had anything to do with the actual science. They were more about communication. You walk into a patient room. The patient is there along with her 9-year-old son. The patient starts to speak to you, but only in Spanish. Her son begins to translate for her. What do you do next? You walk into the break room, and 2 of your colleagues are talking about a patient that they share. One of the colleagues feels that the patient should be placed on amlodipine, hypertension medication, and the other feels that this patient should be on hydrochlorothiazide, which is a different hypertensive medication. What do you do next? How do you solve this issue? You realize while working at the hospital that one of the patients was given the wrong blood during a transfusion. The patient has a very minor allergic reaction, but it's enough that the patient knows something went wrong. What do you do next? Now, I did get a few illegal questions. These are questions that they're not supposed to ask you, and this is exactly how they ask them. Now, we're not supposed to ask this, but we're going to know anyways. So, what were your USMLE scores? We're not supposed to ask this, but do you see yourself having children in the next 5 years? Again, you don't have to tell us that, but I'm just curious. And there you have it. Those are just some of the questions that I've actually gotten during interviews. So as you're preparing for your medical school interview, your graduate school interview, your residency interview, make sure you know the answers to these questions. I wish you all luck and let me know if you need any more help.